Hello, let's talk about bleeding per rectum history taking. So the bleeding per rectum is a very common presentation, gastrointestinal presentation, and it is also common history taking station in the surgical exams. So let's discuss the bleeding per rectum history. So while taking the bleeding per rectum history, the first thing to inquire about is about bleeding details. So the first thing will be bleeding details. We will ask question about the bleeding details, and what question we will be asking about bleeding details. So first will be the onset of bleeding per rectum. So we will ask the patient that when did he or she notice the bleeding. So the onset. Then the second thing to ask about is about the color of bleeding. So we will ask the patients that whether is it the bright red blood, is it the dark red, or is it the black stools or black color of the bleed. So the bright red blood, if the patient has a bright red blood or bleeding per rectum, then we will think about hemorrhoids, which in common language is called piles. Hemorrhoids are some fissure which is tear in the anal mucosa. So if there is bright red blood, then we will think about the hemorrhoids or fissure. If there is dark red or the blood which is mixed in stool, so then we will think about some IBD, inflammatory bowel disease, or some polyps. Okay, so the bright red blood will be hemorrhoids or fissure, while the dark red blood will be IBD or polyps, while the black stool will suggest the melena, and we will think about upper GI bleed. Upper GI bleed. Okay, so the second question to be asked is about the color of the stool. Then we will also ask about the amount of blood or amount of bleeding, that how much is the blood. Is it the few streaks are enough to color the water? Okay, so maybe there will be a few streak of blood, or the amount is large enough to color the water. So in the bleeding per rectum history, we will first inquire about the bleeding details. Then the second thing to ask about is the relation of link or the relation of the bleeding to stool and pain. So this will be the second thing to ask about the bleeding per rectum history. So we will ask the patient whether he or she has pain when opening their bowels or not. So if there is painful defecation, so the painful defecation will denote the painful defecation plus bright red blood. It will denote the anal fissure. Okay, anal fissure. And if there is painless bleeding, painless defecation, then and there is bright red blood also, then this will be hemorrhoids. Okay, so the relation to pain. Now we will also ask about the history of constipation, because constipation is one of the factor which is involved in the anal fissure or the hemorrhoids. So we will ask about history of any straining or constipation. So this is the. We will also ask about the any mucus or slime discharge in the stool. Mucus or slime. So if there is mucus or slime discharge in the stool, then we will think about some IBD causes, inflammatory bowel disease. Okay, inflammatory bowel disease. And if the painful if the bleeding per rectum or the bleeding is associated with the diarrhea, then it will also suggest some inflammatory bowel disease. Okay, so this is the link to stool and pain. The third thing which we will ask from the patient is about the bowel habits. This is very important. So the third thing to ask about the bowel habit. Bowel habit. So we will ask from the patient whether his bowel or her bowel motion changed recently or not. So we will ask about change in bowel habit recently. If there is change in bowel habit recently or new change in bowel habit, then it will indicate, or we will think about colorectal cancer. Okay, so we will think about the colorectal cancer. Any new change in bowel habit plus bleeding per rectum, then we will ask about the colorectal cancer. Then we will, in the bowel habit, we will also ask about diarrhea or constipation. Okay, we will ask about that whether he or she has opening their bowels more or less often than usual. So if there is chronic diarrhea, if there is history of chronic diarrhea, then we will chronic diarrhea plus bleeding per rectum, then we will think about IBD, inflammatory bowel disease, or other infection. Okay, if there is history of constipation or straining, then if there is history of constipation or straining, then we will think about fissure or hemorrhoids. Okay, fissure or hemorrhoids. So this is about the bowel habit. The fourth question to ask in the bleeding per rectum is about the other anorectal symptoms. So we will inquire about other anorectal symptoms. So what we will ask about the anorectal symptoms, that is there any lumps or swelling around the anal region, any lumps or swelling around the anal region. Okay, then we will also ask about any itching or irritation. So itching, if there is any itching around the anal region plus bleeding per rectum, then it will then we will think about the hemorrhoids. Okay, so this will be hemorrhoids. And if there is any discharge or pus, we will also ask about, is there any discharge from the back passage, any discharge or pus, then it will suggest the abscess or fistula. Okay, so this is about the other anorectal symptoms. After that, we will also inquire about the fifth one will be danger symptoms and systemic symptoms. We will also ask about danger symptoms. So which danger symptoms we will be asking about? So that will be weight loss of appetite, tiredness or dizziness, fever, or any night sweats or abdominal pain. So what will be the danger signs? So the fifth question, we will be asking about the danger symptoms or systemic features. So while taking a history of bleeding per rectum, what will be the danger signs or red flags or danger symptoms? Those are the danger symptoms are loss of appetite, the weight loss, symptoms of anemia like tiredness, shortness of breath. Okay, so these are the danger signs. What are the other danger signs? The fever or night sweats, and the last one is abdominal pain. abdominal pain. So these are the danger sign: abdominal pain. So these are the danger sign or red flags in the bleeding per rectum: loss of appetite, weight loss, anemia, symptoms of anemia like tiredness or shortness of breath, fever and night sweats, and abdominal pain. Okay, if there is weight loss or the loss of appetite, then it will suggest, or we will think about malignancy. So if the patient has bleeding per rectum plus he or she has history of loss of appetite or weight loss, then we will think about malignancy. If there is tiredness, or then he or she will be having anemia, and the fever or night sweat will suggest the IBD or any other chronic infection. So this is about the question on danger symptoms. Then after that, in the history taking of the bleeding per rectum, then we will ask about the past history. In the past history, we will ask about the rectal bleeding in the past, that whether he or she has a rectal bleeding in the past or not. So we will ask about bleeding per rectum before or in the past. Okay, then we will also ask about any history of hemorrhoids, fissure, or IBD in the past, any family history, any medical history which is significant for any diseases like hemorrhoids, piles. So in the past history, we will also add the family history, past history and family history. Any family history of colorectal carcinoma or any other diseases. Then after that, after the past history, we will ask about the drug history or medication history. Okay, drug history or medication history. In the drug history or medication history, we will ask about any blood thinners which can cause the bleeding per rectum. Okay, so we will ask about the blood thinners or other anticoagulants. Okay, if the patient is using blood thinner or anticoagulant and he has bleeding per rectum, and also we will ask about the any bleeding from any other orifices like mouth, nose, or ear. So we will ask about those things also. And if the patient has using the blood thinner, then we will think about that this can be causing the bleeding per rectum. Okay, then the other thing which is very important is the eyes component. Eyes is ideas of the patient, okay, or what he thinks about what causing this symptom. Okay, so if the patient has bleeding per rectum, then we will ask the patient what you think might causing this problem. Okay, so we will ask about the ideas. Then the C is for concern, what he or she has concern about, or what is the thing that made them worry the most. Okay, so the eyes component, ideas, concern, and E is the expectation, what he is expecting or what he is hoping that we can do for them today. Okay, so the expectation. So the eyes component must be asked in the history taking stations, every history taking station. Okay, so the one thing which I forgot is before the eyes component, we will also inquire about the personal history. Okay, personal history. So in the personal history, we will ask about the any smoking or alcoholic history. Okay, so smoking or alcohol use, we will ask about in the personal history. So this is the bleeding per rectum history. So let's summarize what we have been through. So in the history taking station, first we will ask about bleeding details, the onset of bleeding per rectum, the color of the bleed, and the amount of bleed. So we will ask it in the bleeding details. Then after that, we will ask about its relation or link to stool and pain, link to stool and pain. Then the third thing to ask about the bowel habits. Okay, the fourth thing to ask about anorectal symptoms, other anorectal symptoms. So this is the fourth thing to ask about symptoms. Then the fifth thing to ask about the danger sign are red flags. Danger sign are red flags. Then after that we will have to ask about the past history and family history. After the family history we have to ask about drug history or medication history and the personal history. Okay, the last thing to ask about the ICE components, ideas, concerns and expectations. So these are the things to ask about in the bleeding per rectum history. Thank you.